4 years ago, the board of Asheville's nonprofit Mission Health System sold control of its 6 hospitals to the for-profit HCA Healthcare. Since then, more than 3,500 doctors, nurses, and support staff have left the system. Patients and healthcare workers have sued HCA over quality of care and working conditions, complaints that continue to this day.
HCA is a private company that is first and foremost to serve its shareholders and to earn them money.
My guests today are journalists Barbara Durr and Andrew Jones. Both report for AVL Watchdog, though Jones recently came over from the Asheville Citizen-Times. Their deep reporting has documented the broad effects of Mission's sale to HCA, and our conversation sheds some light on how one of Asheville's most important nonprofit boards chose to surrender its mission. Advertisements don't sound like ads on the Overlook. They sound like conversations, because they are. Take it from one of my earliest sponsors, Jennifer Goodyear of Davidia Realty.
That was really easy, and I felt really comfortable doing this ad with you. And I'm enjoying it so much that I do want to buy more.
If you market a business or even yourself, make a great impression by advertising on Asheville's hottest show. You can be a sponsor of The Overlook for as little as $100. Ask to learn more by messaging me at matt@podavl.com. That's podavl.com. I began our conversation by asking Barbara Durr to describe the hospital Mission was before the sale and what it became under the control of HCA.
Mission Hospital had been a nonprofit for many decades before HCA bought it. And it had won a kind of stellar reputation for high-quality care and for high-quality medical practitioners. It recruited very high-level doctors. One reason was this is a very nice place to live. So high-quality doctors were happy to come and live here and practice at a well-regarded hospital.
Why did the board of Mission feel the need to sell the hospital?
This is part of the controversy over the sale. Did they really need to sell Mission? The guy Ron Paulus, who was the CEO at the time, was someone who convinced his board that the finances of the hospital were such that it needed to be sold. Now, as we looked back, in particular, this is Pete Lewis's work, as you look back, Ron Paulus was prepping the hospital several years before the sale actually went through in terms of streamlining staff, lowering costs, etc., to make it attractive for a private buyer. And he and a consultant who actually had the connection to HCA, which is where the conflict of interest occurred, they were courting HCA long before any official bid was made. And as Pete discovered, there was really only one other bid. And the board simply blew it off. It momentarily considered that bid and went with Paulus's recommendation, effectively, of HCA.
Was there any outcry at the time? Were there any warnings, red flares that went up from people either within Mission or outside the hospital who smelled something either fishy or just not kosher with this?
Doctors told us that many of them who were near retirement age decided this was the moment to exit medicine because they knew HCA's reputation. So there were people who already could smell what was likely to happen under HCA and decided that it was time for them to bail, take a job somewhere else. And so, yeah, there was already a sense that this was not a good thing in the medical community.
Andrew, give us a sense of your beginnings with covering Mission and HCA.
I came in very much after Mission had been through such a high-profile sale and made even more high-profile by the fact that not only did you have nurses who had unionized shortly after the sale, but also the hospital was facing its first what would be the first of a number of antitrust lawsuits brought by 6 plaintiffs, local residents of the Buncombe County area. So the Citizen Times really wanted to make sure that lawsuit was covered and that any movement within the nurses union was covered as well. And so I came in knowing that there was some upheaval. What I did not expect was 2022, which was a dramatic year in terms of a pushback, is what I've called it in my reporting at the Citizen Times, from numerous parties, whether that is from families who had very disastrous medical procedures at HCA post-sale, or whether it is the nurses repeatedly getting out on the street at 509 Biltmore at the main campus and saying, low staffing, not enough materials, we are suffering, we need support from our community and from the leadership at HCA that we're not getting. Whether it was in the lawsuits where we saw legal teams for various plaintiffs, including those residents, but also 2 counties and 2 cities saying this is a monopoly across the board. There is antitrust action. There's anti-competitive action that is ballooning the prices of health care and insurance for people. 2022 was really a time in which Mission heard the voices of a lot of people from many directions. And that's primarily what I focused on. It was overwhelming at many times.
It seems overwhelming, just the avalanche of stuff you're just telling me, from lawsuits, nurses' actions, ballooning prices. On the surface of things, you'd think, well, it's the same doctors, it's the same staff, the building hasn't changed. What did change operationally once HCA took over?
One of the first things that they did was they cut back staffing in order to cut back expenses. They eliminated some units and cut others to the bone. There was something called the Office of Decedent Affairs, which contained the morgue and some other sort of technical issues. They eliminated that. So, for example, an undertaker would go to this particular Office of Decedent Affairs, be able to get the death certificate, the body, and do whatever needed to be done for a funeral home. Now, a funeral director told me that he can't find the person who actually signed the death certificate. It's all in a morass. That's quite difficult. Security staff was cut. Housekeeping staff were cut. So what happened in the hospital was that, and nurses and doctors were leaving, so the burden on those that remained became far higher and in many respects risky for them to practice. One of the first groups of doctors that left were actually the cancer care doctors. And there was another cancer care center here in Asheville. Many of them went to the Messino Center. They retain privileges, and this is often the case with medical practitioners, for physicians. They would retain privileges if they needed to operate, for example, do a surgery at Mission, but they have flocked to have their affiliations go elsewhere.
You said something about these physicians. You mentioned the cancer center. There are, would you call them clinics? They're under the Mission/HCA umbrella, but they operate independently, all these different physicians groups?
Mission had a number of practices that were associated directly with Mission. When HCA took over, they became associated directly with HCA, okay, under the Mission title. Separately from that, there were a whole host of independent medical practitioners' practices that had privileges at Mission. Some of those have shifted to Pardee or to Advent down the road so that they did no longer have to associate themselves with Mission. A number of doctors also went to the VA hospital, which is actually a very good VA hospital from all the reporting that we can find. So one of the things that HCA did that drove some doctors away, which is they decided that they should see more patients for less money.
You know what's kind of interesting to me, among many things that are kind of alarming to me, you would think that HCA would have had a history of doing this elsewhere before coming here. Can you give us some context about HCA's history in other communities with other hospitals that should have been signals to anybody who cared about what was going on with Mission and the transition would have said, this can't happen here.
HCA was in a lawsuit with Medicare in a conflict where they had built Medicare and they had to repay a huge sum of funds. So that was a notable case in HCA's history. But here's something about HCA that is fair to say. They have a 182 hospital network across the nation. Many of those hospitals are in small areas where they come in and they do provide higher level technology, more equipment, and that sort of stuff. So in some cases, HCA's arrival in a rural hospital could be a good thing. In this instance, HCA acquired not just Mission Hospital in Asheville, but its entire system in Western North Carolina, including some rural hospitals like Angel Medical Center and the Transylvania Regional, et cetera, and those in those smaller hospitals. And curiously, even though HCA can in some instances be a good thing for some small rural hospitals, in this instance, it was not. Transylvania Regional Hospital is a prime case. They were doing the same thing with the doctors' contracts there, and as a small regional hospital, they lost 14 of their physicians. The mayor was alarmed, and they were so alarmed about the conditions at Transylvania Regional that they wrote to the Attorney General and said this needs to be investigated.
You just said something that in some communities, HCA had injected technology, resources, and made these hospitals better. You're saying that didn't happen here, that were these hospitals already at least widely considered very contemporary and had that HCA didn't bring any new resources to the table?
Well, Mission was already an extremely well-equipped hospital. It had probably the best cardiac unit in the region, and it was often the hospital to which any cardiac patients were referred. It was well-stocked, let's put it that way.
So why would the board, and you alluded to this with Paulson, and I guess I want to pull that string a little more, and I imagine the board of Mission must have been pretty huge at this point. It would be a high hill to climb to convince such a large, you would think, informed board to basically absolve itself of its nonprofit status and sell to a for-profit entity. How could a board of that magnitude be convinced to do that?
It's a really good question. And we may never know exactly what the answer is because every single one of those board members and senior executives at the hospital Mission under nonprofit status was obliged by HCA to sign a non-disclosure agreement in perpetuity.
You would think that alone, just the request to sign an NDA would be like, what's going on here that we can't talk about? Andrew, you mentioned lawsuits that started coming up. Can you specify and give us some details about the range of these lawsuits and who initially started filing complaints against HCA?
Sure. There is a pretty wide range, especially at this point. I'll start off with the first antitrust lawsuit that was filed, I believe, in August of 2021. 6 plaintiffs, folks who had their parents in the hospital, folks who were restaurateurs and whose employee base got healthcare from this region. There are massive concerns, going back to this thing that Barbara mentioned a moment ago, that the acquisition of every single hospital within the Mission network was really a move to enrich the company, essentially, instead of provide better health care for folks here.
But who was suing? Were these just people in the community who tried to use Mission for their health care and were getting bad results?
A good example of it would be Katie Button, who's a very well-known restaurateur who has a lot of employees in this area. And she's a good example because essentially the argument that she would make is, I've established a restaurant, I have established employees here, I want to do the best for them as an employer, but it's very difficult when I feel as though healthcare is deteriorating as a result of all these things that we've just talked about right now. Another good example is Buncombe County. Buncombe County itself is now involved in multiple lawsuits of different tunes that essentially allege the same thing. We have an employee base We have an insurance plan. That insurance plan provides for families, but our insurance plan can do nothing in the face of care that is being truncated. Allegations that the hospital itself is one where there are numerous issues, where there's not enough staff, where there's not enough resources to make sure that everybody gets what they need. Buncombe has been involved in another lawsuit, one of the newest ones. This one is out of Knoxville, and it's against Team Health, which is a company that's embedded in emergency rooms to run those emergency rooms. And the allegation in that lawsuit is Buncombe is saying when people come in, they're being coded for something that's more extreme than what they're actually being treated for. So whether it's Buncombe, whether it's the city of Asheville, whether it's the city of Brevard, whether it's the county of Madison at this point, all of which are now involved in a very large lawsuit in the Western District of North Carolina Federal Court, there are just these concerns that we're providing for our employees. We're providing good insurance coverage for our employees. Why can't the hospital system essentially meet us at that place?
I'd like to add one thing to what Andrew was just saying.
Sure.
That has been a factor in the lawsuits, which the antitrust issue is that by being a monopoly, they can charge higher prices than what normally would be charged for a given procedure. So that's part of the lawsuit, which is people are being gouged by HCA Mission on pricing.
I know that pricing itself is an elusive, there's not a set menu that everybody can just look at and know that this procedure is going to cost X amount, that things are very opaque in that way, very cloudy. Have you had a sense, Barbara, of how much, if you can quantify at all, what has been the percentage of price increase for different procedures, different surgeries with HCA as opposed to what it was under Mission?
I think we found, and correct me if I'm wrong, Andrew, I think we have found through other research that HCA was charging, in some instances, 2 and 3 times the cost of a given procedure comparatively in North Carolina.
It's crazy that people that itself wouldn't draw such a huge blowback.
It's a combination of things. I want to, in particular, answer the question about nursing because it ties in with what's going on and how all of this has unfolded. The nurses were similarly, in some ways, affected as the physicians. In other words, many nurses left because they possibly were near the end of their career and they just didn't want to deal with HCA. And so the nursing staff began to significantly shrink. And during the pandemic, as everyone I think probably knows, there was a nursing shortage, period. And of course, the medical care demand had risen substantially. So you got 2 clashing phenomena. And the interesting thing for the nurses was that they were not able to provide the care that they professionally knew needed to be provided. So, example from the nurses I spoke to for the nursing story about a year ago, they had on a surgical ward, they had 44 beds. They would normally have a patient ratio of a nurse to 3 patients. They were functioning at a level of a nurse to 6, 7, or even 8 patients. That means the time that they can devote to each patient shrinks proportionately to how many patients they have to care for. So the consequences were they couldn't take vital signs. They couldn't change people if they were incontinent. They couldn't pass the medications on time, pain relief, cleanliness in the rooms. So all these things affect what actually is happening in the hospital and how the nurses feel that they are at the point of putting patients at risk, and is something that they feel very deeply about.
If you own or run the marketing of a business in this region, nonprofit or for-profit, podcasting is a unique, engaging way to tell your story. These are called branded podcasts. Your company owns the show, and I'm here to help you put one together. It might be a short series or an ongoing production. You already know about the years of great work I did in public radio and now here with The Overlook. I also want to work for you through my studio, Podcast Asheville. email me at matt@podavl.com. That's podavl.com. Let's talk and see how I can help you meet your marketing goals with a podcast that's all your own. You mentioned how physicians left in droves because they felt the conditions weren't safe there. You just touched on how nurses were having to double up their workload and couldn't spend as much attention and pay attention to the detail of their patients. These concerns must have come to hospital officials with HCA. How did HCA officials respond when physicians, nurses, and other hospital staff came to them with these concerns and complaints?
I'll only mention one particular thing because we had it documented. The nurses, after they unionized, created a particular form that is called an assignment despite objection. That form documented the possibility they had too many patients. They had patients that were on machinery, right, that the nurses were not trained for. So all of these issues that came up about care were documented in this assignment despite objection. That form was only filled out after they had already reported it to the supervisor and had no response. Once the form was filed, it would go to the management. And what we were told was that management was dealing with the forms through the union and there were meetings and so forth. But nurses continue to say that they're suffering from some of the same issues that they have documented over time for the last 3 years.
So some of this is related to HCA, some of this is related to the pandemic. I imagine even if Mission held onto the hospital, the times would have been very challenging in terms of healthcare just because of the pandemic alone. Now it's been 3 years or 2.5 years since HCA took over ownership. Has HCA done anything since you both have been doing your reporting to address these concerns, to say, yes, we recognize there's been some difficulty here, it's been rough, and we're going to implement this, or we're going to do such and such? Has HCA given any indication of wanting to partner with their physicians, nurses, and staff?
I would say from my reporting that I have not seen very many efforts to meet very many of the parties that I've spoken to halfway. In fact, I would go so far as to say it seems like the hospital, like HCA, seems to be concentrated on more ways of changing its model in a way that has frustrated people. I think the most recent iteration of this was some reporting that I had done on patient advocates notifying the public, and specifically the Attorney General's office and also the newspaper, that the pharmacy in the cancer center was slated to close on March the 3rd. And there was profound concern about closing that pharmacy because of accessibility issues. The nearest pharmacy was in the other building across the street, and cancer patients were saying we're going to really struggle to pick up the meds that were very easy to access when the pharmacy was in the cancer center itself. The way that the patient advocates framed that was that the hospital is not meeting patient advocates, nurses, doctors, et cetera, halfway by recognizing that some of these changes may affect patients, doctors, nurses, healthcare workers, et cetera, but rather continues to cost cut. And what we saw as a result of the closure of that pharmacy was, in fact, the Attorney General's office sending a letter to HCA asking for an explanation of why that was happening. So we haven't seen any major significant steps forward in a desire to have some sort of relationship with them, except I would say that wages recently went up for nurses, and that was something that they considered to be a pretty profound win. Union nurses did claim that victory. There was a little bit of controversy as far as why that went forward, but it's a mixed bag.
You said the state attorney general sent a letter to HCA asking about this. Has there been a response from HCA to this letter?
Not that I have seen yet. This was a number of weeks ago. Some of the reporting that I had done was basically saying there were a lot of commitments when HCA took over, saying that we're going to make sure that services stay consistent. And my question to HCA was, does this pharmacy closing represent a little bit of inconsistency on your part? And they argued, no, we're not not significantly curtailing the services that we provide by closing this pharmacy. But the AG still wanted an explanation, and we don't know if that explanation has been sent off to his office or not yet.
Barbara, you had a story which I thought this nugget was very telling, that Mission's emergency room is contracted with a subsidiary of a private equity group, Blackstone, to staff it. So we know of Blackstone from Abu Ghraib prison, from Blackstone being involved in dark ops in battle. What is a private equity firm having anything to do with a hospital here, even if it's under the cover of a subsidiary that's handling the emergency room staff?
I think you're pointing to one of the most fundamental issues in healthcare today, which is the greater and greater share of private equity and privately owned hospitals as opposed to public or nonprofit hospitals. So that issue is essentially what we have here with HCA, which is HCA is a private company that is first and foremost to serve its shareholders and to earn them money. While they may say that patient care is a priority, we know that in a shareholder meeting where some shareholders actually thought that the sort of rewards that are given to a given hospital system, one was 80% for financial return, 20% patient care. And there were some shareholders who thought we should really raise the incentive for patient care. And the board voted it down. So it's not A, that they're not aware, right? It's B, they've made a choice. And so the choice is a private company is first and foremost devoted to it making money for its shareholders.
You have to look at the very nature of private equity firms and capitalism and business. Why are these nonprofit hospitals, and you're saying this is happening around the country, right? This isn't just acute to Asheville and Western North Carolina. What is happening in healthcare in mass as an incentive for these nonprofit hospitals and healthcare centers to sell to for-profit entities?
Simple answer. Investors found out how they can make money in healthcare.
Right, but the nonprofit boards who are charged with stewardship of these nonprofit hospitals, call me naive about this, but they didn't get into this. They didn't become a nonprofit health center to make money. So what was their incentive? What is their incentive to sell, to change the very fundamental of what their mission is?
I wish I'd been a fly on the wall in that board meeting and I'd be able to tell you more. I do think that Ron Paulson was a persuasive CEO with his board.
That's an answer to what happened in Asheville. But this is happening elsewhere. So what happens in these nonprofit health center boards to say, yes, we are going to fundamentally change?
I'll give you a quickie answer to some of that, some of the thing that may have motivated the board to make the sale. And that was, you had a promise on the part of the HCA sale that the funds that went from the sale would go to create what is Dogwood Health Trust. Dogwood Health Trust's mission was supposedly to address the social determinants of health. And I believe that some board members, perhaps in their better thought, that's what we need. We need someone who's going to address affordable housing and other social determinants, hunger, etc., poverty, that would help Western North Carolina's population to improve its health. I think they bought that idea, and the sale did in fact create Dogwood Health Trust at $1.5 billion.
I would also note that the question that you're asking is not only a question that you are asking or that folks in this community are asking, but it's one that the FTC and the DOJ are asking right now. They met over video conference with advocates for better health care in Western North Carolina and a Mission nurse during a hearing that was specifically focused on hospital mergers and how they affect communities. I believe this was directly after the Attorney General had visited our community to ask similar questions about what the fallout from a hospital merger looks like. The FTC heard a lot of folks that day who talked very damningly about the effect that a hospital merger can have. And so the question that you're asking right now is really one that I think that America is in the headlights of. We are asking ourselves if there is accountability, if there is enough accountability and regulation to make sure that board members are making decisions not for themselves, not for shareholders, but for their communities first and foremost. And I think just the fact that the FTC and the DOJ is trying to get to the bottom of what happens when there's real problems from a sale is indicative of the fact that maybe we need a lot more answers. And maybe this is a problem not just here in Western North Carolina, but across the nation.
Barbara, you said that Dogwood Trust was created as a result of this sale. Dogwood Trust is a nonprofit, correct? So is Dogwood doing things in this community that weren't being done before? Is there any sort of efficiencies and betterment through the existence of Dogwood?
Remember that Dogwood, which operates as a foundation and has roughly on the order of $2 billion in assets right now, they do not deliver care. They provide funds to nonprofit community organizations to help them deal with, literally, as we speak, the social determinants of health. What are those? Inadequate diet, hunger, poverty that affects, in many respects, non-white communities in Western North Carolina, the lack of affordable housing, various of the sundry issues that might determine how well you are, right? And how, as a consequence, you may or may not need health care. So it's more like preventative kinds of issues. They don't deliver care themselves. There's a gap there. So I have to think that some of the people who made that decision are likely to have some qualms now that they see the results. They're not expressing those qualms publicly, but I can't imagine that their consciences are free of doubt about what has happened to health care since they sold the hospital.
You mentioned, Andrew, the DOJ and the FTC are involved in this, or at least looking at this. Are you getting a sense there are class action lawsuits on the horizon for patients who've received less than ideal care under HCA? Or are you hearing anything happening along those lines?
Can't predict the future, so I don't know, and I can't say from any reporting that I did at the Citizen Times whether or not we will see more class action lawsuits or more antitrust lawsuits on the horizon. What I can say is pointing back to the fact that 2022 was a very busy year. We saw not only class action and antitrust lawsuits come from several individual plaintiffs and counties and cities. We also saw lawsuits that alleged mismanaged care, malpractice. We also saw lawsuits from some of those healthcare providers that we were talking about, that the hospital is treating them poorly as far as employment. We had two women who were trying to move from the Mission system to the Pardee system recently. They were cardiologists, and they said that they were under a contract that they didn't realize that they were under, and that the hospital is now pursuing them legally for trying to make that move. We have a healthcare worker, a doctor who used to do calls, who was saying that he was never paid for the work that he did. These are both documented in lawsuits that I've written about. So what I can say is that given the frequency of litigation aimed at HCA and many of its subsidiaries, I would not be surprised if we continued to see people say in court that this system is broken, and that brokenness aims not only at entire groups of people, but also at individuals, including patients, nurses, and doctors as well. So we'll see.
I guess I'll wrap with this question. What can the community do now that they're seeing the premier, quote unquote, hospital system in this region, at least from the outside looking in, deteriorate in terms of quality, staffing, the conditions, both for staff and patients? What are the options?
A two-part answer. Andrew, I'm sure, has more to say on this. But one of the things that I documented was people in the community are simply opting to avoid Mission if they can. So they're going to Pardee, they're going to Advent, some are going farther afield. They're going to Duke, they're going to Atlanta, they're going to Charlotte, for care. If you will, personal options have shifted to the degree that they can afford and are able to do that.
Which also speaks to a lot of the disparity in healthcare access in this community, that the people with the least access are stuck with what they have right in front of them.
Exactly. And the second part answer, I would say, is that it's difficult for me to imagine HCA selling this system. And the reason is that Mission is one of the highest per patient income hospitals in the entire 182 system of HCA.
Really?
So they're making a lot of money here.
But you said they had to do a lot of cuts and a lot of things to get to that profit. It didn't start out that way. Wow. Andrew, is there anything you want to leave us with about forward look?
You ask about what people can do, and Barbara, you're so right about the fact that people have made the choice, and they've been very vocal about making the choice to go to other healthcare institutions because they're concerned about the care that they get at HCA, which is not all bad, of course. You have a lot of wonderful nurses and physicians who really do provide for this community, but that doesn't mean that people aren't trepidatious about getting involved in the system. What we've seen is a lot of people talk to local elected officials personally, publicly, and say, I want you to advocate for me on commission, on city council, and I want you to speak up, and I want you to use the connections you have to make sure that I don't have to be concerned that my visit to the hospital or my mother's visit to the hospital next week won't be our last. And so I think keeping the conversation as public as humanly possible, whether that means on social media, whether that means with your elected officials, or whether it means with Barbara calling journalists and saying, here's what I'm dealing with. Having the conversation publicly is going to be the perfect antidote to the issue that we saw at the beginning of this sale, which was that fact that so much was done in private. So much was done behind closed doors, and now people feel like that secrecy has become a risk to health itself.
I'd like to thank my guests today, Barbara Durr and Andrew Jones of AVL Watchdog. You can find their work at avlwatchdog.org. If you have thoughts about today's topic, I'd love to hear them and maybe pull them into a future episode of The Overlook. Just leave a voice message on our recorded line, 984-278-7301. Today's conversation happened inside the BB Theater in downtown Asheville, which owners Susan and Giles Collard have been so gracious enough to open to me to record my interviews. Our theme music for The Overlook, Maker's Song, comes courtesy of the Asheville band The Resonant Rogues. The Overlook is a production of Podcast Asheville. New episodes are online by 6 a.m. every weekday wherever you get your podcasts. Sign up for our weekly newsletter at podavl.com. I'm Matt Peiken, and I'll see you on the next episode of The Overlook.